round of applause. And please clap for yourself. We recognize all of you. So with all protocols observed, I say again, good afternoon. On behalf of the African Diaspora Corporation, a private partnership group, I welcome you all to this monumental and historic occasion of unveiling of a new gateway to premium investment and opportunities in Africa, and this will be through the Diaspora Hub. Diaspora Hub is a global digital mobile platform, or you can call it a marketplace, developed by a group of like-minded African professionals in diaspora, determined to make a great human impact, improving the lives of our families and loved ones back home. Our primary strategy to do this is to seek ways to reverse the long-standing African brain drain to bring gain in human capital development by driving diaspora engagement and investment into the continent. This mobile app will now make it seamless for people in diaspora to connect to their homeland. Africa for so long has depended on the West for visual human development and improvement. Even the natural resources in Africa are sent to the West to develop a product and send back to us on a higher price. Why this mobile app, Diaspora Hub, will facilitate many kinds of initiatives like energy and power, skill acquisition, agriculture, education, transportation, and etc. Our initial approach is to focus on housing and healthcare. This single digital mobile platform will offer many real estate companies across the continent of Africa opportunity to publish their properties, making it seamless for diasporans to access them. On health, they say a healthy nation is a wealthy nation. This new initiative will stand out to be a game changer in a healthcare delivery system across the continent. We know one of the key metrics to evaluate healthcare in any country is the degree of access to healthcare by the citizens. And the key driver to access to healthcare is funding. With the current economic crisis across the continent and today's looming global economic recession, we must therefore begin to look for alternative ways to fund healthcare. Due to limited funding, many governments in the continent are facing the serious challenge providing basic public health insurance coverage for all their citizens. Even where they are provided, they are limited to only those in the formal sector, which, as we know, represent only a decimal fraction of the population. Private health insurance is almost non-existent. Today, majority of healthcare costs are paid out of pocket by the citizens. Given the above prevailing challenges, we must therefore look for innovative ways to fund healthcare delivery in Africa to improve the overall population health outcome. This is the mission of ADC. And to achieve this, by creating a diaspora hub, we are already existing duly registered, licensed, and vetted healthcare health maintenance organizations can now publish their health insurance plans on a single mobile platform, making it seamless for Africans in diaspora to subscribe for healthcare coverage and protection for their families and loved ones back home. With this initiative, Africans in diaspora will now not have to worry about phone calls from their families and loved ones back home about unexpected medical emergency costs or worry about money sent to them being diverted for other things like to buy food or other personal needs, while the health care or their health condition deteriorates. On the other hand, their loved ones will now likely seek for health care early as they don't have to wait about the cost or worry about the cost. In the same vein, the healthcare providers will respond timely and appropriately to the care once they know that they will be reimbursed. Situation for both patients and the providers, and ultimately improve the overall population health outcome. In terms of national economy, recognizing the millions of Africans living in diaspora today, this single healthcare initiative is expected to bring multi-billion dollars in indirect investment annually to the participating African countries. It is time for African nations to take their destiny in their hand and leverage on their enormous human capital resources in diaspora to lift African economy and welfare. Do you know, for example, today, Nigerians are the most educated, successful immigrants in America. With that alone, you can imagine the amount of contributions Nigerians are adding to the growth and welfare of America. Oftentimes, we are striving to attract foreign investors into our country and not remembering that almost all their profits that they make will be repatriated back to their respective countries. However, a diasporan Nigerian, for example, investing in Nigeria is likely going to leave that profit in the country, here in Nigeria. My fellow citizens, in closing, Nigeria and Africa as a whole has all it takes to compete with the rest of the world. But we must have the will. This can never be given to us in a platter of gold. Let's be innovative. Let's align ourselves with the 21st century digital technology to bridge the gap between the diasporans and their homeland. Let us turn to the diasporan engineers, doctors, nurses, dentists, scientists, technocrats, environmentalists, etc., to replicate the enormous wonders many of them are performing and contributing to the Western world. Long live the Federal Republic of Nigeria. Long live Africa. Thank you all for listening.
Thank you, ladies and gentlemen. Once again, please, can we give a resounding applause for the board chairman? Africa Diaspora Commission, thank you so much. Dr. Joachim Uche Okafo would like to thank you. Thank you. And now, before we move on this morning, I'd like to very quickly take this time to recognize a few persons that we have here with us. I'd like to, at this point, recognize and especially welcome the Group Managing Director of Citygate Homes, Panos Papanastasio. Would like to welcome him. Please, can we give him a round of applause? I'm guessing I didn't murder your name at some point. Thank you. I'd also like to welcome a board member of the Police Service Commission, DIG, Barrister Taiwo Lakano, retired. Thank you so much for finding time to be here. Thank you. And now, that being said, at this point, I'd like to invite the next person to give us quick remarks. I'd like to welcome the Chairman and CEO of Nigerians in Diaspora Commission, Dr. Abike Dabiri. and to be represented this morning by Honorable Abdul Rahman Terab, FIMC. Please can we give him a round of applause? Thank you.
Your Excellency, the Coordinating Minister of Health and Social Welfare, Dr. Mohammed Ali Pate, OON, still looks young after 17 years. When I personally met him, I was a commissioner for local government in Borno State, and he paid us a visit as the chairman, I believe, executive secretary of the Primary Healthcare Development Agency, and I've not seen any changes on you. We need to know that secret, Your Excellency. Nice to meet you today, and thank you for coming here. The Director General, National Health Insurance Authority, the Director General, the Chairman and members of the African Diaspora Corporation, the Director, the distinguished guests, esteemed colleagues, and fellow Nigerians in the diaspora, gentlemen of the press, I want to start by extending the sincere apologies of my chairman and CEO of the Nigerians in Diaspora Commission, Honorable Dr. Abike Dabiri Erewa OON. Your Excellency may wish to know that she is currently in Lagos to welcome and help coordinate this year's homecoming of the Association of Nigerian Physicians in America, AMPA, one of the largest and strongest medical diaspora group we have in Nigeria and Africa as well. They are here to have their AGM and extend various health support missions to the Nigerian people. Your Excellency, ladies and gentlemen, she has asked me to relay the following message to this important. I'm honored to attend this significant event of unveiling the diasporans. These initiatives showcase the power of collaboration and innovation in addressing the needs of our diaspora community. The Diaspora Hub promises to bridge gaps in Nigerians abroad and their homeland. This platform can unlock opportunities for economic growth, cultural exchange, and knowledge sharing. The Diaspora Health Insurance Initiative is equally exciting, addressing a critical need for accessible health population by leveraging extensive coverage and support for our well-meaning citizens here in Nigeria. The Nigerians in Diaspora Commission welcomes these types of initiatives and recognize their potential. However, we intend to thoroughly assess the Diaspora Health Insurance app and the Diaspora Hub to ensure it meets our diaspora community's standards and expectations. We therefore look forward to working closely with the developers and stakeholders to review the app's functionality, coverage, and overall value proposition. Our endorsement will be based on thorough evaluation, ensuring the app meets the high standard of our diaspora community. In conclusion, we commend the organizers for their vision, the lives of Nigerians in the diaspora. We eagerly anticipate these initiatives and look forward to a fruitful collaboration. God bless in the diaspora, and God bless the Federal Republic of Nigeria. Thank you very much, Your Excellency.
Thank you so much. Once again, please can we give a round of applause for Honorable Abdul Rahman Terab, FIMC, representing the Chairman and CEO of NEEDCOM, Honorable Dr. Abike Dabiri Erewa, OON. Thank you so much. Thank you. Thank you. And now before we move on this morning, please permit me to very warmly and quickly recognize the presence of Dr. Charles Ugochukwu, the former NMA chairman, FCT. Thank you. And I'd also like to very warmly take this time to recognize the presence of Dr. Kasimir Anyango, PhD. Thank you so much for finding time to be here. Thank you. I'd like to very quickly welcome, for a quick remark, the board chairman, Police Service Commission, DIG Barrister Taiwo Lakano, retired, FDC, LLM, for a quick remark. Please, can we give him a round of applause as he comes forward? You come this way, sir. Just this way. Thank you. Keep clapping as he comes forward, please. Thank you.
She said you should keep on clapping. Good morning, Your Excellency, our Honorable Minister of Health and Welfare, I guess I'm right, other Excellencies, Honorables, our host, Dr. Kafo, members of the press. Let me make that short. My name is DIG Taiwo Lakano, retired. I'm here in my personal capacity, but I'm a member of board of Police Service Commission, not the chairman yet. So let me go through the protocol quickly. It's indeed a great delight to join you today as we celebrate the launch of the DiasporaHub app, a groundbreaking tool poised to transform lives, bridge continents, and unlock the vast potential of our collective heritage. To the brilliant minds behind this initiative, big congratulations. Today, you have gifted our global community more than an app. You have created a bridge that connects ambition to opportunity, vision to reality, and the diaspora to the heartbeat of Africa. The DiasporaHub app is a testament to what is possible when innovation meets purpose. By prioritizing accessible health insurance, you are safeguarding the well-being of families who have long navigated fragmented systems through real estate investment opportunities. You are empowering generational wealth and fueling the growth of thriving communities. And by creating a hub for economic collaboration, you are igniting a spark that would light the path towards shared prosperity. This is more than technology. It's a movement that honors our roots while advancing our future. It reminds us that our diaspora is not defined by distance, but by dedication to uplift, to invest, and to champion the boundless possibilities of Africa and its people worldwide. As we launch this app, let us remember, every connection made, every investment secured, every life improved through this platform is a step towards a brighter, more united tomorrow. Clap for me, please. I have a strong conviction that the DiasporaHub app will serve as a beacon of hope, a catalyst for change, and a testament to the power of unity. With gratitude and unwavering optimism, I want to say thank you and God bless you all. Happy celebrations. Thank you.
Ladies and gentlemen, please keep clapping before he sits down, even if he's already seated. Thank you so much, sir. For some reasons, I just thought that maybe you just have a little touch of also being such a comedian because you made us all laugh during your presentation. Thank you. Can we celebrate him one more time? Thank you. Thank you, sir. Thank you. And now to move on this morning, I'm about to welcome somebody who's going to make the next remark. A very, very distinguished guest here with us, and somebody who's very important as much as the app that we're about to unveil today is concerned, and about what we're here for is very concerned. I'd like to welcome the Director General of the National Health Insurance Authority, Dr. Kelechi Ohiri. Ladies and gentlemen, can we give him a round of applause? This is a very special guest. Keep clapping until he comes forward for the DG, National Health Insurance Authority. Thank you. It was actually an oversight. We should have recognized him before now. Thank you so much, sir. Thank you. Thank you, sir.
I won't ask you to keep clapping. Honorable Coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Pate. Permit me to stand on already established protocol today. All the excellencies, distinguished guests, esteemed colleagues, good morning. It's my pleasure today to make these remarks at this landmark event. I feel that I have been somewhat part of this process from the first series of meetings I had with the group, which culminated in a virtual call that we had. And I must say that we are here today is a testament to the commitment and the tenacity of the group to actually address this particular need in our country. So congratulations once again. Today is more than an event to just launch an app. It's the beginning of a bold and new chapter in African healthcare financing, where we look for innovative ways to finance healthcare access for many Nigerians. $19.5 billion. $19.5 billion was the amount in diaspora remittances in 2023, according to the World Bank. That amount has continued its upward trajectory after its initial decline during COVID. When you examine what the diaspora send these monies for, part of it is for investments, part of it is for just general upkeep, but in the top three is always paying for healthcare. Up until now, a lot of this healthcare was paid for out of pocket, which meant typically when our loved ones have a healthcare need, they reach out, and well-meaning Nigerians in the diaspora send money to address that specific healthcare need. This contributes to the fact that healthcare expenditure in Nigeria is about 70% out of pocket. There is a better way to do this. And that better way is through health insurance. It says that we pool our risk. It says we pool our resources together and prepay for these services. And this will enhance access to healthcare for all Nigerians. Hence, I was very excited when the concept of a diaspora health insurance came up. Because as a country that has prioritized access to universal healthcare coverage, which is one of Mr. President's major commitments to Nigerians, and this was exemplified when he launched the Nigeria Health Sector Renewal Investment Initiative, which is led by the Honorable Coordinating Minister for Health and Social Welfare. This initiative will definitely move us along that trajectory to achieving universal healthcare coverage for all Nigerians. Health financing in Nigeria is a long way from where we want it to be. But the good news is that we're not resting on our oars, and we're making determined effort. In the NHIA, we started with a strategy focuses on 4 major pillars. The first is to expand coverage from all Nigerians. We started with a baseline of about 16.7 million Nigerians covered by any form of insurance, December 2023. As of the December 2024, that number went up to 19.4 million Nigerians. was the largest increase in 1 year, a testament to the collective effort that most Nigerians have made. We'll continue this trajectory because, one, health insurance in Nigeria is now mandatory. Secondly, together we will continue to increase awareness to tell Nigerians that there's a better way to pay for healthcare. You don't have to wait and pay out of pocket at 2 a.m. when you're sick. And thirdly, we continue to rebuild trust to make sure that health insurance continues to deliver for all Nigerians. The second focus of Mr. President has been on equity, ensuring that no Nigerian is left behind. That's why the coordinating minister set an agenda to reduce the impact of vulnerability on Nigerians. First, by crashing maternal mortality. And so we started in NHIA keying into that by providing the free access to comprehensive emergency obstetric care in Nigeria, where we're working with providers, health insurance entities, to ensure that if a woman is at risk of dying in childbirth, that she can access care, and financing will not be the barrier or the determinant as to whether she lives or dies. Since this program was launched, over 3,000 women have benefited. Over 200 referral centers in Nigeria have signed MOUs with the NHIA to continue to do this. We also recognize vulnerability occurs in different ways. That's why the Basic Healthcare Provision Fund ensures that the poor, the internally displaced, those who suffer from disabilities are all covered under it. And to show the commitment of the government, the budget was doubled from about 150 billion in 2024 to about almost 300 billion in 2025. Again, signaling more commitment to ensure that Nigeria's path to universal healthcare coverage is not one where only the rich get covered and we wait for it to trickle down to the poor. We're saying we don't want to leave the poor behind. We must be intentional about covering them. And we are very comforted by the fact that the principle underscoring the diaspora health insurance is the same, where those who have Nigerians who are in the diaspora are paying for healthcare for those who do not have. I think it was Martin Luther King that said that we are caught in this inescapable network of mutuality. What affects one affects all. Health insurance is a form of solidarity, and the diaspora health insurance underscores that solidarity, where what used to be known as a black tax, where if you're making it abroad, you have to help people back home. We see it as an investment in the human capital. After all, as Chinua Achebe said, Africa is people. So I see this not just as a plan, not just as an app, but it's a commitment, one, to our mutuality. It's a commitment to equity. And it's also a commitment to ensuring that Nigeria moves a step forward in achieving universal health coverage. So I'd like to use this opportunity once again to congratulate everyone for being here today and for all the actions that we are taking today. And thank you for partnering with government to ensure that we use existing platforms, accredited HMO plans in Nigeria, to actually ensure that we continue to finance access for all Nigerians. So thank you very much once again, and congratulations on this auspicious occasion. Thank you.
Thank you. Once again, please, can we put our hands together for the Director General of the National Health Insurance Authority. Thank you so much, Dr. Kelechi. And just like he said, with the Africa Diaspora Hub app being launched today, we're definitely on track as part of efforts to get Nigeria to achieve universal health coverage. Thank you so much. Thank you. And now, as we move on this morning, or this afternoon, I beg your pardon, I'd like to invite one of our partners, one of the health insurance partners of the Africa Diaspora Corporation. This morning, I'd like to receive the MD and CEO of NEM Health Limited, Dr. Chidi Onyedika, for his quick goodwill message. Please, can we put our hands together as he comes forward? Thank you.
Good afternoon, Honorable Minister for Health, Professor Pate. Good afternoon, sir. And of course, my own DG, the man that have transformed health insurance in Nigeria within the short period he came. At least I'm a testimony to that. And what we are doing today and the opportunity that we have, the environment that we have, was actually created by him. And that's why I say thank you, sir. We appreciate you, sir. And also chairman of the board and the board members and all the other dignitaries present. It's with great joy that we are here today. For me, the joy is in two ways. Seeing a vision come to pass. And then the other one is chairman. I was asking Honorable Amadichi, why did you choose April 8th to launch this program? Because today is my birthday. So, so it's double celebration for me. Now, I said it's a dream come true in the sense that for us that we approached to be part of it, we had a dream of having a diaspora plan. And that was something that we were working on, especially for us in HMO, until Dr. Kafo called and said, this is the plan they have. Can we be part of it? And it was so easy to integrate because we're already working on a template by the time that he called. So the launch today is not just about an app, but it's about a vision rooted in connection, compassion, and commitment to those who are far away from here, but they have a passion for their relatives back home. Many may wonder why Diaspora Plan. The plan is not a plan for those living abroad, but it's our normal plan locally, domestic plan, but we are giving opportunity to folks abroad who have a concern about their relatives back home, for them to be able to purchase the plan for their folks back in Nigeria. And what ADC has done is to provide a marketplace where it will be so easy for Nigerians, no matter where you are in the world, to purchase a plan for your relatives back home. And the beautiful thing is they have partnered with HMOs that are forward-thinking, HMOs that are committed to quality care, quality service, so that our folks abroad, not only paying for the plan, but you're so sure that your relatives are in good hands. I'm particularly excited, let me say it again, about my DG, the environment you created. It has enabled us to innovate more. It has enabled us to be more creative, like what we are seeing in the Diaspora Plan, and so many other things. So the usual traditional way of doing medical insurance is being overtaken by some level of innovations coming up, where you see HMOs partnering with fintech companies to provide care, seamless care to Nigerians. And I think at NEM HMO, we are championing that. Now, this plan, like I said, is a normal domestic plan, but it offers a customized plan for Nigerians, digital, because these folks are abroad. They need to know what is happening. And so their utilization is so clear, they can see it, they can monitor what is happening with their relatives back home. Of course, access to top-tier hospitals. Now, all the hospitals we are working with are providers accredited by the National Health Insurance Scheme because it's mandatory that we have to work with them. But for us in NEM Health, we've decided to even extend further, where we have a project of having at least 3 hospitals in all the local government areas in Nigeria to enable us to have a wider provision for the enrollees. We make available to them telemedicine. A lot of my colleagues have left the country practicing abroad. I haven't left yet, that's why I'm still here. And I don't think I'm planning to do that. So we make available telemedicine service for Nigerians to consult from the comfort of their home. Even some of our folks who have left, like my brother that I did house job with many years ago, we just discovered last night, that we are house officers together. We can leverage on their expertise, no matter where they are, providing the same care back home for Nigerians. Second opinion services are available in this plan. And of course, the trust that they have in the providers that are providing this care for them. In conclusion, I just want to thank again, Chairman, sir, for this innovation. It is not ordinary. I have been in health insurance in this country since 2006, and this is the time we are having this come up. It's not as if the diasporans have not been there all this while. But for you to come up at this time, and even for you to be launched on this day, April 8th, there must be something divine about it. So I just want to thank you, and also thank you for the opportunity given to us to be part of this dream, part of this vision. One commitment is that we can't fail. What we have started today, 5 years from now, sir, you will discover that we have added so much in the achievement of universal healthcare coverage in this country. And that is what we are determined to do. Not just collecting premium, but providing quality care for the enrollees and increasing the enrollee count that DG said, if you want to be his friend, give me the numbers. And sir, I promise you, just give us 12 months. Snap us now. 12 months later, snap us again. You'll discover that there has been a change in the number and the quality of care given to Nigerians. And in particular, thank you again, sir. The environment. I keep repeating this, and maybe you might not know, as I said, I have been around since 2006 in the industry. I know what we have seen in 2 years. It's been amazing, and I thank you so much. God bless you.
Thank you so much. Once again, would like to appreciate Dr. Chidi Onyedika, MD, CEO of NEM Health Limited, one of the health insurance partners of ADC. Thank you so much for finding time to be here and for speaking to us this morning. And as we move on very quickly, at this point, I'd like Dr. Sylvester AJ to kindly come forward to us. Thank you.